Every woman and girl has the right to freely and responsibly decide how many and when to have her children. World Contraception Day reminds us that we need to increase awareness around the different birth control methods that are available for this woman and her partner, that they may be able to decide how many children they want and when they want them for the best reproductive health outcomes.
When I think about World Contraception Day, especially in 2021, it's about have we shifted our discussion around who needs contraception the most. I think in Uganda we've seen, and probably in different parts of the world, that teenage girls are in crisis, that the rate of teenage pregnancies is exponential, and yet Uganda still remains one of the countries with the highest rate of teenage pregnancies traditionally. And so when we look at our discussions and our strategies and our ideas, are we now focusing on the young girls who actually need contraception and family planning the most?
As you know, young people may or may not be in control, but the sooner they get in control of their own sexual and reproductive health, the better. The current situation is dire. 1 out of every 4 girls in Uganda is pregnant by the age of 20, and much more so below the age of 18. And this means that many girls are not likely to continue with their school, and it's going to be a vicious cycle of girls not going to school, their babies not going to school. We know in some places in Uganda, like the Butaleja district, where there are 27-year-old grandmothers. This needs to stop. So for me, my call to action for each and every Ugandan is to ensure that all girls and young women reach their fullest potential. This potential includes them not having babies early and also being responsible for their reproductive health.
Research has shown that some of the main barriers to uptake of contraception, especially amongst adolescents, is one, the lack of information about contraception, as well as the lack of adolescent-friendly health services.
So my call to action for the different stakeholders and young people is that let us try hard to fight against teenage pregnancy. Let us give opportunity for these young people to learn, to train them so that they know about this. Because even HIV prevalence is high, but if they know about this, they can abstain. If they have the information, then they can know how to use the contraception, and so they will keep this information, and then they will not be victims. Thank you.
I see that our population growth, if you look at it, it's quite high in Africa. I think we have Guinea-Bissau, then you have Chad, and then Uganda. If you look at the population growth, currently we stand at about 3.1% every year. I don't think most of our youth really plan for families, so we have so many young families, and already now we are about 47 million Ugandans. In the next 10 years, if we're continuing with the same trajectory, the population will be so big. Do we have enough resources? I don't know. I don't think so. Do we have enough jobs for these youth that are coming into the market? I'm not so sure. Therefore, the question is, are we giving the youth and the families choice where they can actually decide which method they should actually use? No. I mean, if you look at the cost of condoms just as a contraceptive method, it's quite expensive. So the government needs to actually now do more. It needs to empower these youth to get easy access to these contraceptive methods, and also work with non-profit organizations to sort of entrench these solutions in the market so that we can have a population that we can plan for, empower, and ensure that it actually impacts our economy at the same time.
A research by Goodmark Institute, Makerere School of Public Health, and Public Health Ambassadors Uganda revealed that during the COVID-19 pandemic, in the initial lockdown of 2020, there was a large disruption in young people's access to contraceptive care. However, it also highlighted young people's need and demand for contraceptive care. It's the responsibility and commitment of the government of Uganda and its implementing partners to provide the services that young people need. Not only the services, but also the information that will be able to guide them to make the right decisions. Now more than ever, it lies upon each and every one of us to make young people's future brighter. With increased access and utilization of contraceptive care, we will be able to see more young people, especially adolescent girls and young women, stay longer in school, attain their dreams, and not be tied down by the responsibility of unwanted pregnancy.